Hi, dear students. Now let us know some terms from the locomotion and movement, the other terminologies which are used for joints, and some important aspects of this topic. Sometimes these terms, if they are used in multiple choice questions in your NEET examination, you should be able to understand what it is. So let's go through. You have already gone through now the 50 questions which I selected for this topic, the 50 MCQs I have discussed with you. Now, as a concluding part of this topic, let us go through these important words or the terms. Uniaxial diarthrosis. I have told you diarthrosis is synovial joint only. Uniaxial, what does it mean? Allow movements in single anatomical plane. For example, elbow joint and knee joint. Single plane, okay? Like this. In one plane only, the movements are allowed. So that is what called as uniaxial diarthrosis. Mainly the hinge joints come in this. Then let's take up the next biaxial diarthrosis. Allow movements along two planes or two axes. So same synovial joints these are, but having two axes, biaxial, allow the movements along two planes or two axes. For example, metacarpophalangeal joints. So the joints between the metacarpals, right? These are the metacarpals and the phalanges. So these movements between the phalanges and the metacarpal, they are in two planes. You can move in two planes, okay? So they are biaxial diarthrosis, okay? So you can make the movements sideways also to some extent and up and down. Okay, now let's take up the next one. Multiaxial diarthrosis. Allow movements in many planes or axes. For example, hip and shoulder joints. They are called as multiaxial diarthrosis. So the shoulder joint, for example, it can allow movement in many directions, many axes. Like this I can do, like this I can do, right? I can rotate it as well, okay? So these joints are, the ball and socket joints are multi-axial diarthrosis joints. Next, yes joint. Sometimes multiple choice questions may include these type of terms. Yes joint. Let's see what is yes joint. It is a joint between atlas vertebra and occipital condyles. Atlas, the first vertebra, and the occipital condyles of the skull. So this joint is allowing flexion and extension of the neck. This is called flexion and this is extension. Flexion, extension. So it's called as yes joint because when we nod our head to say S, this movement is taking place. Yes. Okay. When we say, when we want to say S, not verbally, by head movements, we nod the head. That is yes joint. Okay. What is happening there? The joint between the atlas vertebra and the condyles of the skull, they are moving. Okay. Then next, no joint. Of course, this joint helps us to say no. It's a joint between the atlas and axis vertebra, first and second vertebra, which allow only lateral rotations. So when we shake our head to say no, then we are using this joint. So therefore it is called as No joint. Atlanto-axial joint we call it. Okay, because the ring like atlas and the uh, axis vertebra behind it with the odontoid process, so that allows the sideways lateral rotations. No. Okay, no joint. Now let us look into some of the important joints in our body. Like here we have the atlanto-axial joint. Okay, no joint we call, and multiple axial joint, ball and socket joint. Okay, then biaxial arthrosis, diarthrosis, biaxial diarthrosis, that is the condyloid joint between uh, radius and carpal bones of the wrist. It is like this. And then the uniaxial diarthrosis in one axis, that is the hinge joint. Okay, then here the saddle joint between the trapezium carpal bone and first metacarpal bone, between first metacarpal and the carpal. So we see here it is the saddle joint. Then this joint is the plane joint. Okay, between the tarsal bones. It's also called as gliding. It can glide in all directions. So this axis also, so biaxial. Okay, this is also having two axes, so biaxial. So like this we have different types of joints. Understood? Now remember some points to remember, some facts like smallest bone in our body is the stapes, that is the ear ossicle, third ear ossicle. Then smallest muscle is stapedius muscle attached to the stapes, and longest bone is femur or the thigh bone, remember, which is longest. And again, in females it is longer than the males. And sometimes back in my one of the video I have explained to why the women have the longer femur or thigh bone than the men, uh, because they have to take their babies on lap. Okay, when the legs are folded, the lap region should be wider enough in order to accommodate the baby. Okay, then longest muscle is sartorius muscle. Longest, that is sartorius muscle. And largest muscle is gluteus muscle, gluteus maximus muscle, which is there in the buttocks. And this sartorius muscle is, if I'm right, it is the muscle which is running along the femur bone. Okay, then strongest joint is hip joint. Our hip joint is the strongest joint, remember. And the weakest joint is shoulder joint. You know, this joint is very, very weak. One incident happened with one of my friend. He was of the age, middle age, around 50 above, and he was stepping down from a ladder. We had gone to visit newly under construction ship. Okay, so after looking into its different compartments, it was a huge ship, um, because in the Maldivian island they were making the huge safari ships in that island using only the wood material. So it had got two-floor structure. So we had gone into it, and we had seen all the different compartments of it. And then when we were coming down, he was stepping down through that the ladder, the normal ladder. wooden ladder, and his feet slipped. When his feet slipped, what happened? He fall down, and while falling down to support, he put his um hands, or the both the armpit across the ladders, that the step, like this. And the force was such a huge that because he was falling down, and when it was pushed from down, these the ball and socket joints, they got dislodged, and the femur sorry the humerus head came out, like this on both the side. He was in severe pain, and he was crying. Then we had to immediately rush him to the hospital, and then he was hospitalized, and operation was done, surgery was done to correct that one again, because the ligaments were torn completely, and from the socket, this the head, the ball of the humerus has slipped off the place. So that is possible because it's the weakest joint. Okay. The strongest bone is a lower jaw bone. Remember, the mandible is the strongest bone in our body. It is very, very difficult to break this jawbone. So that is the strongest bone in our body. And hardest part of the bone in all the bones we take up in our body, it is the covering of the teeth, enamel of the teeth. What we have, each tooth, sorry, has got a covering, hard covering, that is shiny white covering, that is called as enamel, and that enamel is the hardest part in our body. Okay. So that's all. I remember these important terms that may help you in solving the MCQs in your NEET examination. Okay, that's all. Bye bye.